Vitamin B12 deficiency is one of those silent problems that can develop slowly, almost invisibly, until the symptoms become too serious to ignore. Many people live for months or even years with warning signs they do not fully understand. They blame stress, aging, poor sleep, or overwork. But sometimes the body is sending a much more specific message. It is asking for help. And one of the most important signals it can send is a lack of vitamin B12. Vitamin B12 is essential for the production of red blood cells, for the health of your nerves, for brain function, and for DNA synthesis. In simple words, your body cannot function properly without it. When levels begin to drop, the effects may start small, but they can grow into serious physical and neurological problems if left untreated. That is why recognizing the signs early is so important. The first alarming sign you should never ignore is extreme fatigue. This is not ordinary tiredness after a long day. This is the kind of deep exhaustion that does not improve much even after sleeping. You wake up tired, move through the day feeling weak, and struggle to find the energy for normal tasks. This happens because vitamin B12 is essential for making healthy red blood cells. Without enough B12, your body may produce fewer effective red blood cells, reducing the oxygen delivered to your tissues. The result is a constant feeling of low energy that can affect every part of your day. The second warning sign is pale or yellowish skin. Some people with vitamin B12 deficiency notice that their face looks unusually pale, dull, or even slightly yellow. This change can be easy to overlook, especially when it develops gradually. But it may reflect the fact that your body is having trouble producing healthy blood cells. In some cases, red blood cells become fragile and break down more easily, which can lead to a mild yellow tint in the skin or the whites of the eyes. If your complexion suddenly seems different, and you also feel weak or dizzy, this could be a clue that something deeper is going on. The third alarming sign is shortness of breath or feeling dizzy. If you find yourself becoming breathless after light activity or feeling faint when standing up, do not ignore it. When vitamin B12 is too low, oxygen transport may be affected because of impaired red blood cell production. Your heart and lungs then work harder to compensate. Some people feel their heart racing, especially when walking, climbing stairs, or doing simple physical tasks. Others feel lightheaded or unstable for no obvious reason. These symptoms may appear mild at first, but they can become more frequent over time. The fourth sign is tingling, numbness, or pins and needles in the hands and feet. This is one of the most important warning signs because it may indicate nerve involvement. Vitamin B12 plays a key role in maintaining the protective covering around nerves, known as myelin. When there is not enough B12, nerve signals may start to malfunction. You may notice a strange tingling in your fingertips, burning sensations, numb patches, or a feeling that your feet are less sensitive than before. Some people describe it as wearing invisible gloves or socks. If deficiency continues for too long, nerve damage may become more difficult to reverse, which is why this sign should never be dismissed. The fifth alarming sign is problems with balance and coordination. People often assume balance issues are simply part of getting older, but that is not always true. If you feel unsteady while walking, stumble more often, or feel like your body is not responding the way it should, vitamin B12 deficiency could be involved. Because B12 affects the nervous system, low levels may interfere with the way your brain and body communicate. You may feel clumsy, weak, or less confident in your movements. In older adults, this can be especially dangerous because it increases the risk of falls and injury. The sixth sign is memory problems, confusion, or difficulty concentrating. Vitamin B12 deficiency does not only affect the body, it can also affect the mind. Some people begin to forget things more often, lose focus in conversations, or struggle to think clearly. Others feel mentally slow, unusually distracted, or emotionally different. In more severe cases, deficiency may contribute to confusion, mood changes, depression, or symptoms that resemble dementia. This is one reason B12 deficiency is sometimes called a hidden condition. The symptoms can imitate other problems, making it harder to recognize. But when the brain is not receiving what it needs, the consequences can become serious. The seventh alarming sign is a sore tongue, mouth problems, or changes in appetite. This may sound less dramatic than neurological symptoms, but it can be an early and important clue. Some people with vitamin B12 deficiency develop a smooth red swollen tongue that feels sore or burns. Others experience mouth ulcers, a strange metallic taste, or a reduced appetite. Because eating may become uncomfortable, some people even lose weight without understanding why. These signs may seem unrelated at first, but together they can point to a nutritional deficiency that deserves attention. What makes vitamin B12 deficiency especially concerning is that it can happen for many reasons. Some people do not get enough B12 in their diet, especially if they eat little or no animal products. Others eat enough but cannot absorb it properly. This can happen with age, digestive disorders, certain medications, low stomach acid, or conditions such as pernicious anemia. In other words, deficiency is not always about what you eat. Sometimes it is about what your body can no longer process effectively. The good news is that vitamin B12 deficiency can often be detected with blood tests and managed when identified early. Treatment may involve dietary changes, oral supplements, or injections depending on the cause and severity. But timing matters. The longer the deficiency continues, the greater the risk that some symptoms, especially nerve-related ones, may become harder to reverse completely. That is why these signs should never be ignored. If you are constantly exhausted, feel tingling in your limbs, notice balance problems, struggle with memory, or see unusual changes in your skin, tongue, or breathing, do not simply assume it is stress or aging. Your body may be warning you that something essential is missing. Vitamin B12 may be needed in small amounts, but its role in your health is enormous. It supports your blood, your nerves, your brain, and your energy. When levels fall, the body speaks. The question is whether you are paying attention. Recognizing these 7 alarming signs early could help prevent more serious complications later. Sometimes listening to your body at the right moment can make all the difference.